Good morning. My name is Anthony Pearson-Shaver. I am a pediatric critical care physician here at Palms West Hospital in Loxahatchee, Florida. Palms West Hospital is one of 11 training programs within the HCA East Florida Division graduate medical education group. I actually grew up in Cleveland, Ohio, but I consider myself largely a Southerner. My parents grew up in Georgia and East Kentucky in the mountains. I grew up in Cleveland, went away to college, went to medical school, and came right back to the South and spent most of my life, in my adult life, in Georgia. I was one of those people that did pretty well in high school. I got high SAT scores. I was a National Merit Scholar and a National Achievement Scholar. I went to Wesleyan University in Middletown, Connecticut, and surprisingly, I majored in music. And that was an agreement that I made with my dad because the first place I got into was Oberlin. And since I had been playing clarinet since I was 6 years old, he did not want me going to a conservatory school. He wanted me to be a doctor. So the compromise was that I would go to someplace other than a conservatory school. I would major in whatever I wanted as long as I took the classes that were required to get into medical school. I then went to medical school at the University of Cincinnati. And following medical school, I trained in pediatrics at Akron Children's Hospital. Because I used the United States Public Health Service to help support me through medical school, after residency, I was an active duty U.S. Public Health Service officer commissioned for 2 years. And following that commission, I was a reservist officer for another 12 years. Following my active duty time, I went to Pittsburgh, where I was a fellow in pediatric critical care medicine. Following my fellowship, I then went to Augusta, Georgia, where I grew in the ranks. I started as a junior faculty member at the Medical College of Georgia and ultimately was promoted to professor, was the chief of pediatric critical care medicine, and the chief for medicine at Georgia Children's Hospital. Feeling that I wanted to see what it was like to be a department chairman in a university, I moved to Macon, Georgia, where I was department chair at Mercer University for 4 years. And after that position, I then moved to Loxahatchee, where I assumed the position of program director for the Pediatric Residency Training Program. As a program director, my primary job is to train residents or to train medical students to become doctors. During the period of time that they are training to become independent practitioners, we'll say, that is their internship and residency. So it is my job to provide the curriculum required, the clinical experiences, and to help them to build a knowledge base so that they can then function independently as general pediatricians. In our program, we feel that it's very important that our residents have the potential to do whatever they would like when they finish. So that we want them in a position to be able to go back and work in a big university if they want to do academic medicine, to go and do further training in a subspecialty if that's what they would like to do, or if they would like to be primary care physicians and go into practice, we want them to have that option as well. So far, since I've been here about 3 years, each year we've sent at least 2 people into pretty competitive pretty competitive fellowship programs. So I feel pretty good about the training that we've been able to provide to people here. You know, the question often comes up, why'd you decide to do what you do? as I was sort of talking to you about my journey, my dad decided when I was about 7 that I was going to be a doctor. And we sort of fought about it back and forth because personally I wanted to be an engineer and travel all over the world. And then when I was in high school, I had decided that I wanted to be a classical clarinetist. So we made an agreement when I left home, that, as I mentioned, I could major in whatever I wanted, as long as I took the classes required to get into medical school. Once in medical school, I actually thought that I was going to be Fifth Avenue psychiatrist in New York. I wanted to be uptown. I wanted to be able to charge people a whole lot of money to come see me. My fantasy was that I was going to drive a mother of pearl Corvette because I was making that much money. Well, then I got into medical school and started exploring all the subspecialties. And the subspecialty that just seemed to fit for me was pediatrics. And it was a little unusual and strange to me as to how that happened. I didn't understand a thing about pediatrics. I was very afraid of children when I started that rotation. And because I was so unfamiliar with the terms that were being used on rounds, each morning after we finished rounds, I had a list of terms I had never heard before. And I ran off to the library for about an hour to look them all up. Well, after about a week, and we used to do 12-week rotations. So after a week, the senior resident came to me and asked what was going on. I explained to her, I'm lost. I don't know what you guys are talking about. And before I can go see any patient, I feel like I really need to read up on these things. She suggested, just follow me around. You just stay with me for the next 3 weeks and still make your list. We'll talk about some things while we're rounding and seeing patients, and then you can go home and look things up. And that ended up being probably the best rotation I had. The interesting thing about this young lady is that I almost followed her into fellowship too. One of the places I interviewed to be a fellow was at Children's Hospital of Pennsylvania in Philadelphia, where she was completing her fellowship. So it was ironic that the person that got me interested in pediatrics, I almost followed her to the same training program in critical care. It's as part of these talks, speeches, it's very often that people want us to sort of encourage the STEM, encourage the students to get into medicine. And I will tell you, I think basically you need to figure out what works for you, and that's where you need to go. The things you need to understand is that you got to work for it. Now, regardless of what you do, you've got to work for it. And I also believe that there are no extra people, that everybody has an important job. I believe that everyone that works in this hospital building is important, from the cooks in the kitchen, to the people that deliver the food, to the people that keep the place actually physically intact, to the people that clean it, to the doctors and the nurses. I think all of these people are important because otherwise it doesn't work. And if you look at our society in general, the same thing is true. Most of us would not do too well if we didn't have a mechanic. Once upon a time, I could have tinkered around with a car, but my car has so many computers in it right now that I'm not really sure that I would know what I was doing. And I think that it's really important that you all realize that, yeah, we're talking STEM and we're specifically talking about medicine here, but the more important thing is for you to find something that you really feel like you're passionate about. Find something that you can do well. Some of you really are good with your hands. And find something that you can do with your hands and learn to do it and work at it and just be the best you can be while doing it. The whole idea of salary comes up. I am going to tell you, I'm not going to tell you what my salary is. I'm not going to tell you what my salary has been. I think the physicians will be very comfortable for probably the next 20, 30 years. But I don't think there are going to be very many millionaire physicians anymore. I don't think that I think that the day of the millionaire physician is past. I don't think there will be very many physicians who are making $900,000 to $1.5 million, $900,000 to $1.5 million while they're practicing. Though I do think physicians will be comfortable. I think that as a physician, most of you would be able to buy a house by the time you're 30, 35, be able to drive pretty comfortable, nice cars, take reasonable vacations. But at least at this time in the United States, you're also going to have a really big loan bill. You know, most people finishing medical school now have at least $100,000 in debt. So again, if it's something you want to do, if your brain and your heart tells you that that's where your passion is, you can do it and you will live very well. But that's not the only, medicine is not the only profession in healthcare. Certainly you are all aware that nurses will always be in demand. As a matter of fact, nobody comes to a hospital for the doctors. They come to the hospital for the nurses. The doctors may well make the diagnosis, but it's the nurses that actually take care of the patients and nurse or nurture the patients back to health. An interesting story, a colleague of mine brought her daughter to me as to be an observer, for an observership. And she was toying with medicine or some sort of STEM field. And after following me around for 2 days, she went back home, told her mom that she wanted to be a nurse because the nurses are doing stuff. The doctors just walk around and talk. And from time to time we would do procedures, but what she saw, the people that were actually interacting with the patients were the nurses. So I think that's an important thing for people to recognize about the difference between medicine and nursing. There are many other professions in healthcare. There are people that take care of ventilator problems and respiratory problems that are called respiratory therapists. Those of you who are probably a little bit more interested in chemistry and how various chemicals or drugs affect the system may be more interested in pharmacology. Believe it or not, there actually is a subspecialty in engineering called biomedical engineering. And some of those people work in hospitals, some of them work in research labs. If you've seen I think it's the Toyota robot, the Toyota robot was built by biomedical engineers. And they built it because they were trying to figure out how to develop an exoskeleton, a skeleton, a suit that you wear on the outside that will help people who couldn't walk. There are, believe it or not, for those of you who are artists, there actually is a school for medical illustration. And lest you think that that's not important, most of our medical books are illustrated. That is, somebody draws those things. We do not cut human beings open to show the relationship between different organs. If a orthopedic surgeon has an idea for a new joint, then that has to be designed by someone that is facile with computer-aided design. So there's a lot to be done in medicine, but as I said in the beginning, there are just a lot of other professions that our society needs. And I think that you just need to really understand what your passion is and follow that. The one proviso, and we haven't talked about this, but it's just a warning. Be careful about your social media footprint. I am aware of physicians and medical students who have really lost a lot as a result of some less than appropriate interactions that they had on social media. So please be careful about whatever it is you put out there in the blogosphere or on your social media pages. I'm a doc. I've enjoyed it. I mean, I have truly enjoyed my career, but I don't think it's the only career out there. And at least my own experience with my children, I recognize the fact that they can be very involved in healthcare as because my wife is a pediatric ICU nurse, so my kids saw it all the time, and they've all done very different things, and they've been successful. You know, again, I think that as you are studying, probably the most important thing, particularly if you're at high school, the important things for you to learn now are to read and write. And I know that sounds like I'm sort of going back to the early 1900s, but understand that for the people that you're going to interact with, that your ability to be able to think through a problem and then record what your thoughts are and your thought process is very important, particularly in the field of science and engineering. So, and in order to be able to do that, you've got to be able to write. You've got to be able to translate your ideas from your head through your fingers into some sort of format that people can read. You can speak all day long, but the spoken word is not as durable as the written word.